And so, welcome everyone. My name is Gregory Gale. I am the Director of Recruitment and Admissions for the College of Psychology at Nova Southeastern University. And I am delighted to welcome you to our presentation. Our presentation today is on smoking, vaping, COVID-19, a dangerous mix. Our presenter today is Dr. Linda Sobel. Now, Dr. Sobel is the President's Distinguished Professor at Nova Southeastern University. She is nationally and internationally known for her research in the addictions field, including the development of timeline follow-back. She's a fellow in the American Psychological Association, Divisions 1, 3, 12, 25, 28, 38, and 50. She's a fellow in the Association for Behavioral and Cognitive Therapies. She's a motivational interviewer trainer, is board certified in behavioral and cognitive psychology from the American Board of Professional Psychology. She currently serves on the Board of Trustees for that organization. She's a council representative for Division 50 to the American Psychological Association and is a member of the Board of Scientific Affairs. She's given over 300 invited presentations and workshops, published over 300 articles and book chapters, served on 9 peer review editorial boards, and authored 9 books. She's the past president of the Society of Clinical Psychology of APA and of the Association for Behavioral and Cognitive Therapies. For over 4 decades, she's been the recipient of grants from several federal agencies. In recognition of her research accomplishments, she has received numerous awards, including the Betty Ford Award, the Norman Zimbird Memorial Lecture Award, Cambridge Hospital and Harvard Medical School, and the list is quite long. So we are delighted to have her present on smoking, vaping, COVID-19, a dangerous mix. 2 things before we start our presentation. As you've noticed, this session is being recorded, and the recording will be posted on our website next week. And please use the chat feature if you have any questions concerning this presentation. So without further ado, Dr. Sobel.
Thank you very much. We'll turn this slides on in just a second. What I want to do is give you a bit of an introduction to not only smoking and vaping, but COVID. And we hear so much about the regular virus, and then we have the Delta 17, and people are wondering, why is it so dangerous, and what's causing that? So I'm going to give you that information so that you will have it to make a better informed decision, but more importantly, also to talk to your clients or patients about it. And then at the end, the good news also is that we are offering and have been offering since COVID totally free smoking cessation services, both in individual and groups. And we can do it face-to-face and virtual. So you'll have numbers at the end of the screen and the phone number, and we'll get back to you within 1 to 2 business days. So let me share the screen. There we go. Okay, and then I'm going to go up here. There we go. So we're all on, right? I guess. Yeah. Okay. So let me go. One of the things that you're going to be surprised at is the next slide. And even I forget about the two-edged sword. The first slide is going to surprise you. It surprises all of us. The second slide says, don't take this as seriously as it is, because we're concerned about the accuracy of this and so forth. So here we go to talk about why it's a two-edged sword. This sentence in and of itself is probably one of those that if I hadn't told you about, you'd say, I think she's got it wrong. Smokers are less likely than non-smokers to contract COVID. And there are several studies, 2 from the US, 9 from China, showing that the prevalence of smokers among hospitalized COVID patients is significantly lower than the current population. And you kind of scratch your head and say, what is that all about? Or did Linda put the wrong slides in? But WHO cautioned against concluding that smoking is a protective factor. That's the first thing that jumps out there. Oh, I can smoke, I won't catch COVID, I don't need the booster. That's not correct. What happens is there's research that's rapidly expanding, there's confounding factors, a number of other things that aren't sufficiently examined. So it's not something that actually we want to put out there to anyone because it's not a protective factor. So let me show you something that I think I went ahead a slide. Okay, there we go. So here's the news that we all know about, and that is smokers with COVID are more than 2 times greater likelihood to be in the ICU, ventilated, and or died. So those are very, very strong figures. And so there's nothing good about smoking, and it's actually antithetical to getting COVID. So you're more likely to. There may be a more severe progression. Now, some of the reason is because these folks have COPD. We already have damaged breathing abilities and so forth. People are on oxygen and so forth. So the progression goes faster because of the damage to the lungs already. So there are typical comorbidities and risk factors for higher severity of COVID-19. And it gets even worse with the Delta virus. So, we want to be careful what we say to people, but by and large, we have comorbidities with smokers. They're more likely to be in ICUs, ventilated, and die. So here's the new news. I was about 5 weeks ago, watching probably CNN, and I had been wondering why Delta is so severe. And I think the next series of slides will show you that. But also not that I'm promoting masks, although I think the masks are one of the ways to keep away from getting Delta now. But these are pretty impressive figures coming from the provincial medical centers and endorsed by CDC. So what happens is these are bacteria from respiratory droplets that are spread. Now, one sneeze, if you're singing, if you're talking, or if you're coughing, with no masks, you'll see the bacteria there, and they start to increase. With masks, there's a tremendous amount of protective effects, and that's why they can talk about masks being a very good thing. We're not saying that anyone should mandate them or not, but I happen to personally think it's a good idea. Now, another one, look at the distancing. So where did the 6 feet come in? You'll see it here. Again, this is with a mask. Bacteria is very minimal, after coughing for 15 seconds. But if you look at the distance factors, here we see that 6 feet is the best to have. So that's where some of these data come from, because I know I had questions before on this. And so let me put that there. But this is the one I want to oh, there's one more. Or is this now? Okay, so when wearing your face coverings with any of these things, again, masks are protective. So you might say, well, what is that, Linda? Is it a series of clouds? What have you got up there? Something new that we're seeing in space? No, that's a cough from a COVID person. And what happens is, if you think of when you see somebody smoking a cigarette, when they blow out, it's kind of like this. It's a big blob of something. And this is why the Delta virus is very difficult and spreads, because it isn't droplets. If you go back in the early days, we were talking about droplets. So let's just say 5, 6, 7 droplets, and they would get on, something. But this is something that if somebody coughs and you walk into it, first of all, if they're not masked, it's all over the place. And that's why they're concerned about these big outdoor venues and so forth. But if somebody's sitting next to you on a plane or someplace else and they cough, this is what's going to come out to you. And that's why the mask is really, really protective, because it's just coming out in a big shield. And so there are many more, you might think of this as many more droplets. And that's why, among other reasons, that we have the Delta variant being really quite serious. So the risk of using with COVID-19, if you're looking at, you've got smoking and vaping, cannabis or tobacco, they're not any different. I mean, you've got different measures of intake, obviously, and with smoking, And vaping, it goes into your system, and within 30 seconds, it's really to your brain, much faster than any other drug. Now, it goes out faster, and that's why it explains why people will light up every 30 minutes or an hour, because they're needing that bolus of nicotine. And nicotine is the drug that they're addicted to. The other stuff in the cigarettes are, some hundreds and hundreds of various chemicals that are going into your system, like arsenic and nicotine, things that we normally would not put into our system. But they are there because they help cure the tobacco leaves quicker. So there's all sorts of interesting things that one can learn about this. But we have to remember that cannabis is there, and whether or not it's medical marijuana or not, it's still the same kinds of things that are going to be going on in your lung. Perhaps from a protective standpoint, it's a little bit better with medical marijuana, but not. So you get lung inflammation from all of these things. You get immune response in the lungs. And what happens is then you get COVID-19 exposure. And if you already have these problems, you have a number of things that can happen to you. A risk of infection. And as I said earlier, worse outcomes from the infection. So there's nothing good for smokers with COVID or with Delta at this point. And that's why we need to communicate. And one of the things that I do also for a living is I'm a motivational interviewing trainer. So when you have a smoker, one of the things that you might say, because folks are pretty sensitive to the stigma and that, and they've been told 1,000 times that to stop smoking, it's not good for you. So what we do in motivational interviewing is we say, we notice that you're a smoker. Would you be interested in learning a little more information about how smoking and the Delta virus, or you can say COVID, are a mix, or what they can do? When you ask permission in motivational interviewing, what happens is, because again, it's so antithetical to what healthcare providers do, they don't ask. Your doctor doesn't ask, do you mind if we talk about your blood pressure? And frankly, it's a good way of introducing it. Once somebody says yes, then you've got the entree. The other 5% are probably not ready to quit or change, and I don't have time to go into how to talk to them, but just simply asking permission. And particularly if they're coming to you for any other reason, for trauma, for depression, whatever, what we want to do is still ask permission. So do you mind if I notice that you're a smoker, do you mind if we talk a little bit about that? And as I said, 95% of folks actually will say yes, and there you go. Okay. So what happens is, just thinking about what's going on here, and smoking and COVID, it damages the lungs' defenses against invasive bacteria and viruses. Well, there is the problem. You've got a virus going in, and it is not a good thing. And you've already got compromised lung function. One of the interesting things that can happen, it's the only drug that we know that if you stop, you are going to have improved health functioning. Again, I don't have time to show you that, but I can say even within 3 or 4 hours, your blood pressure will go down. Within 5 to 10 years, your health will be similar to that of a non-smoker. So one of the lines that we have is, it's never too late to stop. So the only thing that the residual wise, and that's where this still comes in, is that while you can have all the cancer risks and so forth go away after 5, 10, 15 years, what does not ever go away is the COPD, and that's the damage to the lungs. Now, what happens is we see older adults that have been smoking for 20, 30 years on oxygen tanks and so forth. And that's where it gets difficult here. So again, you've got the damage to the lungs, and again, you can't process these things quite as well. So there are serious concerns involving the respiratory system that actually will lead to death in these cases. So the compounds in cigarettes actually weaken the immune system. As I said, there are hundreds of chemicals that are not good for anything else, but they do cure the tobacco leaves and preserve them quite well. And also, if you try to smoke a tobacco leaf, it wouldn't be fun. So you actually enhance the ability to smoke the tobacco leaves when you have all these chemicals and the curing that occurs with the tobacco leaves. So smoking does do a number of things. Initially, it increases the risk of heart and lung disease, cancers. Smoking has been what we call, it's the biggest cause of mortality and morbidities, meaning this is, if you smoke, it's going to increase your diseases, it's going to increase your deaths. Now, another reason that it's such a risk is that in the 60s, 60% of people, and they talk about people being 12 and up, were smoking cigarettes in the US. We've had a big secondhand smoke movement and so forth, so that now we can't smoke indoors. You can't smoke in hospitals, you can't smoke in schools. But nevertheless, we're down to probably about 16% of the adult population smoking cigarettes. And if we add in younger folks are going to vaping because they have been told it's safer, it's flavored, young kids are smoking it, there's lemonade kinds of vaping and so forth. So the percentage of smokers are probably up around 20%. However, if you think of heroin and cocaine, less than 1% of the population uses heroin or cocaine, and if we were to survey them at the present time. So because of the large numbers with smokers, let's say 20% of 20 out of every 10, we have the biggest cause of mortality and morbidity. Just as a little side, obesity, which is really an epidemic in our country and maybe in many other countries, even Japan now, is inching up and maybe taking over smoking and obesity. Smoking. So we've got a susceptibility if you're a smoker, if you're a vapor, if you're using cannabis and so forth. And there is, unfortunately, even though vaping has been around for a long time, and longer than many of you probably will think about, there is no legislation on it to speak. Big lobby companies came to Obama, believe it or not. It was a surprise for a lot of us to hear. And as you put pressures with lobbyists and that on the president and various other things, the FDA was going to work on a ban. That did not happen, is not happening at this point. And there are many other issues in our country that probably will put this on the back burner for a while. But it is not a good thing in any respect. It's basically, we've got new diseases coming up with the vaping and so forth. It's a very different mechanism of delivery rather than tobacco coming directly into the respiratory system. So there's a lot of concern. There's a lot of things that are said about it that aren't accurate, but that's true in most of what goes on in our society now with social media. But there are, as I said, what surprises a lot of people, and I don't think people really care about this because they're going to do it anyway, but vaping affects the respiratory system very differently than smoking. Nevertheless, you're still affecting the respiratory system, and that's where it gives way to more diseases and difficulties with the COVID, more deaths and ICUs and so forth. So vaping started as an alternative, and it's like electronic cigarettes. It administers the nicotine without burning the tobacco, basically, so you don't have the leaves in there. It's a different delivery system. And it is not good for the respiratory system, but it doesn't make any difference. It's still affecting the lungs. What happens is these devices, you see them if you walk around the malls or the gas stations and that, they use little batteries to heat up the fluid, and that's what goes in. You're actually inhaling the fluid there. And it's a different mechanism, as I said, the way they've attracted children legally or illegally is making all sorts of flavors, from chocolate to strawberry to lemonade and so forth. So the most popular vaping devices, let me move my thing here, is what's called the JUL, Juul. It counts for 3/4 of the market. And you'll see it, they sell these starter kits and so forth, and they're not regulated by the FDA at all. Again, just like with cigarettes, they probably contain a variety of compounds that are detrimental to your health, but nevertheless, they're not regulated at this point in time. So as I said, there's fruit, mint flavors. I have to confess, I have not tried any. But what the younger kids say is that it's much more flavorful, and it's more enticing to smoke all of these flavors. There are probably 20, 25 different flavors out there, so you have a variety to choose from. But really, that isn't the reason that they're out there. It was a way to entice adolescents into banning using vaping. And it's very easy to get. I mean, you can go any place to get it, as I say, gas stations, the malls, any place like that. There's smoking shops and so forth. And of course, you can't sell it to underage people, but we know that that doesn't stop adolescents. So what they have said is that we're not marketing to kids. We can't do that. They're underage. But if you look at all of these, you know, guess who's using them? So just to give you a kind of a look-see, if you've never looked at a vaping system, is that it looks exactly like this, and there's inflammation of the lungs and damage to the air sacs where oxygen exchange occurs. And so what you have is you have the electronic vaping associated lung injury and COVID-19, and that is what is 1 and 1 is not 2. And that's where we're seeing. And plus, a lot of these folks already have a compromised immune system. Okay, now there are other things that are out there. They're more popular. They're not as popular as vaping. Vaping took off because it's quite easy. But there are hookahs in the state, in the provinces up in Canada. Hookahs are very common. People go in there like a coffee shop, and you can use that or water pipes. But one of the problems with the hookahs is, as you see in the diagram, there's just one thing that one entryway in, and people share these hoses and mouthpieces. Now, hookahs are really common. They've been common for years. It might be that you just haven't been aware of them, or they're not legal in certain states. But what happens is this is an accident waiting to happen. You're sharing the mouthpieces. You're sitting very close together. Obviously, like eating, there's no face protection. And even if you're not there and you're just socializing with folks, there's secondhand smoke, as there is with regular cigarettes. So it opens the gate for infections and the carrier of COVID, and now with the Delta virus, same kind of thing happening. Okay, let's see. I think we've already talked about that. I changed the slides a little bit from the beginning. So with smoking and vaping, it increases the risk of COVID. What happens is it unfortunately requires you removing your face mask. So if you're around somebody that's vaping, that's where the secondhand smoke not only can come, but so can the exposure to COVID. So you've got the nose and the mouth. You're repeatedly touching your mask as part of the face. One of the things that hasn't been said much about masks, we have these nice blue ones that are cheap and inexpensive, and even now the N95Ks, and that's what I've gone to because they're 3 layers. And if a mask is good, 3 layers is even better. And that doesn't get mentioned much, but you can actually put special little protection devices in there that make it a 3-layered mask in some of these, not with the blue ones. But what happens is you're touching your mask, whatever it is, except for the washable ones, they do get dirty. I mean, if I wear makeup, I notice that all over the inside of my white, nice NK95, it has nice, makeup on it. So, and sometimes we don't wash those, or not told. Let me go back here, sorry. Trouble. And so we actually are re-exposing ourselves because it's on the mask for a little bit of time. So the estimated a person smoking a pack of cigarettes a day touches their hands to their mouth about 300 times a day from smoking. So basically the re-exposure part from your own mask is considerably greater. So now if you're not a non-smoker, you can be touching it, but if you're touching it that often, it's going to be a greater risk. So dealing with the pandemic, quitting is difficult in and of itself, and the relapse rate with smokers is quite high. On average, it depends on what study you're reading, but on average, a person will tell you when you're asking them when they're coming in for services, how many times have you seriously, not have you tried to quit? Because people will say, I've tried to quit 1,000 times. I mean, Mark Twain has a famous quote about that. But about 3 to 6 times on average. So people have a history of not being very successful. Now they might, if you ask them on a scale from 1 to 10 how ready they are to quit, they may not be very ready. But on average, there is a very high relapse rate, and it's within about 90 days. It happens for a lot of reasons. We have less cues in the environment. We don't have ashtrays all over the place. You can't smoke in somebody's office now. They put signs on the various packages. I know in Canada, they talk about risk of impotence related to smoking. Well, people turn those cigarette packages around and don't look at them. So negative advertising hasn't helped. And it's the same thing with vaping. One of the problems that we have is that young people start vaping or smoking, but let's just say vaping, and it's a social pressure kind of thing. And then it also has some enhanced benefit. Nicotine is a stimulant, although people will tell you that it relaxes them. That is not the method of drug. It's a stimulant. It's not a strong stimulant like other kinds of things. But once somebody stops, there are other people around smoking, and there are other cues. People go outside now to smoke in Florida. I mean, I don't know what the weather's like in the winter in other places, but it's very easy to smoke even outside in a restaurant. And now that we have outdoor eating, that's even greater. So you have decreased mortality, morbidities. I say you're going to take maybe 5-10 years off your life if, in fact, you do not stop at one point. And with young people, let me go back to that. What happens is there's social pressure. It's a very positive thing to do. They're getting some stimulant effect out of it. And here's the kicker. We have the least success getting young people, I don't care whether it's 13, 10, 8, up to 30, young people to quit. And the reason is when we say and give a message, smoking is bad for you, it causes cancer, and does this, this, and this, they are not walking around. What 18-year-old or 13-year-old has caught cancer from smoking? So they don't believe us. And a lot of times their parents are in their 30s and 40s. And a lot of these deaths don't occur until 50 or 60. So it's called a bad message. It falls on deaf ears. And so it's just what we call an informational threat, and they don't believe it. So that's why we have such problems in younger people right now, and particularly with young women who are, why we don't know, but much more susceptible to starting using some kind of nicotine device. Okay, so if people tell you, by the way, that it's too costly, you recommend an NRT. NRTs are nicotine replacement therapies. For many years, they had a prescription necessary. Now, because we are so successful getting people to quit either through a behavioral program, but a behavioral program and an NRT, because they're used to the nicotine bolus and then they can taper off. You can say to somebody, at these bigger places like Costco's and Sam's, actually the cost of an NRT for a month is cheaper than smoking. So at least they don't have that to blame on them. But we do know if somebody is highly addicted to smoking, and I'll tell you one question you can ask as a practitioner. You can say, how many minutes upon waking do you have your first cigarette? And if somebody says 30 to 60 minutes, they're extremely addicted. And if you did a DSM or ICD, what you would see is, of course, that they're very severely addicted. And other folks that maybe are social smokers, it will be easier for them. But the very addicted smokers probably are going to have some trouble coming off the nicotine rapidly. So you can taper them off. There are free patches available in almost every state. You can just look up online. So you can call in Florida. The information is there at the Florida Health Department, but you can call and get free patches. There are gums to do, and you can plan in advance using the gums and then park it. All sorts of ways to do that. There's inhalers that you can use. So some people nowadays, two things that are different than from 20, 30 years ago. One is that we have people using multiple NRTs because they're so addicted. So you might have both the gum and the patch. And then there are many people now that are staying on the NRTs for their lifetime. Now you say, well, isn't that bad because they're giving them nicotine? Yes, it probably could be looked at that way, but in fact, they're not taking those other hundreds and hundreds of chemicals into the lungs. And that's why you're not getting lung cancer and heart attacks and strokes if you do stay on the nicotine patch. It's very similar if you think about how methadone maintenance got developed. People have been on methadone maintenance for 40, 50 years, and that's better than getting arrested and all of these other things. So there are many people that do say that if a person is having trouble, NRTs can be used for a long, long time and multiple ones. And as I say, it's not a prescription anymore except for some very minor things and so forth. Also, people are more likely to smoke and vape together, believe it or not, but when they're stressed and they're bored. So both of those things are two different things. And when you're stressed, you might say, well, a stimulant doesn't seem to be the best drug. Again, to use the word again, antithetical, although people will tell you that they use it when they're stressed and it relaxes them, it really can't do that in terms of the mechanism of the drug because it's a stimulant. We don't really know why folks say it, but they say it. And boredom is the other big thing around COVID. People are at home, not able to do things. So we've actually seen an increase in alcohol use and in smoking. So it's important, I think, to be able to talk to your patients or your friends, colleagues about it. Okay. Let's see, let me see where I am here. Hold on. Okay. So in terms of how young people have responded, young vapers to the corona epidemic, what you see here is this was a survey that was done. Percent agree or strongly agree. 57% worried that my vaping puts me at risk of serious illness from COVID. 52% of that population, you can have multiple answers here, said they want to quit vaping. So what you've got is an audience out there. It's not that our smokers, when we were only having smoking and not vaping, people would say to us when we do our surveys or they would come into our clinic, yes, they really want to quit. But again, reminding you that many of these people are older and having disease problems, respiratory problems, and have failed several times. But they say, I really do want to quit, doc, but I've tried so many times before. That's where that kind of conversation saying it's never too late. There are nothing but good things that happen to a person when they stop, and their health will be back to that of a non-smoker at 10 to 15 years. Using that information, we've been able to get some people to think seriously about that because they have information that's really wrong. I can never not be affected by cancer or heart attacks, stroke, blood pressure. They can. It'll go away the longer that you stopped. 48% of these people, so these two things are really, really suggestive of why you might be able to easily either refer somebody or talk to somebody. Half of them say that, I'm going to take questions at the end, so I see that somebody's raised this, but we have plenty of time. I saved about 20 minutes for that. Are looking for information about how to quit vaping, so they want to quit, getting information. If you have pamphlets, there are a lot of good pamphlets out there that can be put into your office and that you can hand out or have on the counter. So they want to talk to somebody. I'm just having trouble with my screen there. And then talk to my parents about vaping. So you've got a smaller percentage talking to their patients, but these are young vapers that want to do something. So I think it really is encouraging. And these are 15 to 24-year-olds that they're at least interested in it. And the more that you do it in, so tell me something good. One of the ways we talk to folks about any particular drug or even vaping, we use what we call a decisional balance, and it's part of motivational interviewing. So we ask about the good things of a drug use, and we ask about the less good things. And some of you, if I could see your faces, would probably be going, "Oh my goodness, you're serious? You talk about the good things of cocaine use?" Yeah, we do. And the reason that we do is because we want to validate somebody's behavior. There are good things initially about using any drug. And with smoking, unfortunately, it takes many, many years to have the cumulative effects where somebody does have a spot on their lung or cancer or so forth. And that's why we have so much trouble trying to convince young people, because they don't see those effects. In fact, they get very different positive effects and social support from their friends. So that there are some good things going out there, and we'll say, tell me some of the good things about, first of all, do you mind if we talk a little bit about your vaping? So asking permission, first MI trick. Second, use a decisional balance. We all do it, whether you're being offered a new job, whether it's to go out to eat tonight, and you might go out if there's open seating outside. My husband and I will not go into a restaurant, and we'll wear a mask outside when we're not eating. But you make decisions. What are some of the good things and less good things? And I can tell you that we had not gone out to eat up until about 3 months ago. So we took a bit of a chance and we weighed pros and cons. People do the same things with the use of drugs or vaping. So we'll ask somebody, what are some of the good things? And they'll go, blah, 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 give you 6 or 7 things. And so I'll say, so it sounds like, you reflect back, it sounds like there are a lot of good things about, vaping. So let me ask you about the other side. What are the less good things? And before I finish this discussion, what happens is when you ask about the good things, you're validating. And then not only are you validating, but rather than start coming out of the starting gate going, what are the bad, or lecturing, you ask them to give voice to the change process, or the description. So then you've got the good things. And so you say, so let me go to the flip side. What are some of the less good things? And so you not only do not start out on a negative note, but you're validating with a good thing. And people, when you ask permission and ask about the good things and then go to the less good things, actually talk to you. And it will be the same thing, whether it's heroin or cocaine. If you don't believe me, ask me to send you some literature, but there are about 2,000 studies from the MI literature showing this is the case. So once you have the good things and less good things, what you can do if you're in practice, you can say, so it sounds like there's some good things on the one hand, but on the other hand, you're also recognizing there's some less good things, and you repeat back what they are. So where does that leave you? So you have a conversation with somebody, and it can be your good friend, it can be, somebody in your family. Where does that leave you? So what you're doing is trying to get the scale to tip in favor of change. The biggest single reason people stop using a tobacco product, now this does not hold for vaping because young vapors have not been around for a long time, is that they either are told that they have a spot on their lung, they have cancer, or their spouse has died. So that is the grim reaper, and those are pretty negative consequences. On the other hand, if you're just catching them early, there's lots of good reasons why they might want to stop. What you're looking for is like, what will tip the scale? With older adults, sometimes their kids won't let them see their grandchildren because they don't want to expose their child to secondhand or third-hand smoke. And if I have a moment at the end, I will explain third-hand smoke to you. But again, what I'm suggesting doing is having a very brief conversation. We train docs in the state of Florida. I've been doing that for decades here now, on a very quick 90-second conversation with somebody that's coming in for something else, medication refills, diabetes, something, and they go through a very quick thing of saying, do you mind if we talk about your smoking? And I notice on your medical history. And then you say, what are some of the good things about it? And let them talk. And then, so let's do the flip side. What are some of the less good things? So then you ask them to look at where they are in the change process. So this is not an MI lecture, but I just wanted to take the time to communicate that you have some very easy skills to talk to folks about changing. Okay, so secondhand smoke increases the risk for COVID, and that's because of the kind of thing I just showed you. If you see the same kind of cloud thing, it's going out in more than just droplets. It's in a big smoke screen. And so that is why it is spreading, one of the reasons it's spreading so rapidly. It also, as a virus, it is more deadly. And apparently, and I'm not a virologist, but apparently as these things mutate, there's a tendency for them to get worse and worse and worse. Let's just hope that we don't get anything beyond Delta. So secondhand smoke increases the risk for COVID-19 because of the same reason we talked about earlier. Anyone can get COVID by an infected smoker who inhales near them. So one of the things we don't want to do is be near smokers. And so if you've got a smoker in the household and you're treating somebody, there's probably some things that need to be done in terms of at least asking them to go outside and not infect other people. I'm going to give you the third-hand smoke. We don't have a way to do a quick survey here, but so many people have not heard about third-hand smoke. What third-hand smoke is basically what the chemicals in a cigarette or vaping or whatever is coming out embeds themselves in fabrics. So they embed themselves in your clothes. Now, I don't know if you've ever been around a smoker, but I have a very good friend that smokes like a fiend, and everybody can smell it. I mean, the dentists tell you that they can identify a smoker quicker than any other healthcare practitioner because the time the person opens their mouth, not only are their teeth stained, but they smell. But so it embeds themselves in your clothes, in the drapes at home if you're smoking. But worse yet, think of this for kids. My daughter's a pediatrician, and she takes a moment to talk to her families about this. The embedding is not just in the drapes, it's in the carpet. Or let's make it worse. Let's go to the car and the family says, or the mom and dad says, well, I don't smoke when, Simon is in the car. But you've got the car seat where there's, fabric. And all that smoking, while they're not smoking with the children in the car, are embedding themselves in this very, very close contact with the kid. So the children are being exposed to second and third hand smoke. And that's why we see breathing difficulties, increased asthma, and other kinds of things going on there. So when somebody is talking about smoking, I ask them if they smoke in their car, in their house, particularly if they have young kids. But for those, if you're looking for a reason to get somebody to stop smoking, some people will say, oh, you tell me that it will affect my dog or cat, which it does. It affects the lungs of animals. I'll quit. So we've had some people quit because of their love for their animals. So it's idiosyncratic, but whatever you can use to get somebody to smoke, we call using whatever we can as an affective hook, something that will prompt them to smoke. Okay, so anyone can get COVID who exhales near them. Worst scenario is the indoor group gatherings or in poorly ventilated areas. Of course, across the country now, you cannot smoke in closed football stadiums and closed other things, but you can go down the ramp and smoke in some areas. So it is a frightening thing how easy this thing comes up. The air expelled carries droplets or particles, or in this case, it's containing a whole smoke screen of the virus, and that's what's going on here. So being around an active smoker, even with the mask, because of the widespread there, it is dangerous. So I don't know how you're going to use this information, but I used to go through the airports when we could travel easily, and always in the airports, and they would have these signs, no smoking. And then I saw one when I traveled recently that said no smoking and vaping. So vaping has become really, really popular, not just with young people, but with others. I'll see them get off the plane and vape and so forth. It's also, for whatever silly reason, it's not quite as stigmatizing, and I don't know why, but we still have studies to do on this. Quitting vaping or e-cigarettes is tough. What we do is we'll help you to quit. These are 3 ads that we run, not only on our marquee, but wherever else I'm talking. We have free individual services. We have free group services. All of our services are available in Spanish and English. And the programs that we use are what we call evidence-based. meaning that they had been evaluated in randomized controlled trials, both in Spanish and English. Our primary number, and somebody will get back to you within 24 hours, is 954-262-5861. We run these ads all over the NOVA campuses and every place else. Same thing, and quitting smoking. So let me stop on that note. We're not doing this anymore. Undo the screen and come back, and we have a lot of questions. I see. You want to field them for me?
Yes, yes,
Shall
but
I go?
Dr. Sobel, one of the questions actually concerned one of your slides, your
Okay.
earlier slides. I think it was the slide that showed someone either coughing or the one before showing the lungs, based with individuals with or without masks. I think that
Right.
was a very
And the question was what?
well. Carolina just wanted to see the slide one more time.
Oh, okay, not a problem. So that was at the very beginning, right?
That is
I
correct.
believe
Yes,
so.
I
Okay,
think
okay,
that's a very strong piece
yeah,
of evidence concerning mask wearing.
yeah. Well, and I look. You can kind of get a sense of how I feel about mask wearing, but I don't want to make this about being a mask advocate, but you can get the sense of how I feel. So let me just go back up there. I got this share. Now I've got to open this up again.
Mm-hmm.
Let's see. I closed it down. Okay, there we go. So let me go back to the beginning. I think
Yes.
you were talking about these first three slides. Oh, yeah.
Yes,
Let me open
exactly.
back.
Yes.
Okay, okay. So let me just, you see where my thing is?
Yeah, the
Gotta,
slideshow and
if
then
I open that
show.
up wide, oh, there we go. Okay. And slideshow, hold on guys. Play from current slide. There we
Yes.
go. It should, okay, so there we go. There's the three. Which one did you want to see, or all of them?
I
Go
think
ahead and
she,
talk.
the next one, I believe.
Okay,
Um,
there we go. That one, the distance
yes,
one.
yes. I
Okay,
think that's
yeah,
very strong. Yeah, she did say that one. Yes, so
yeah.
I believe she may wanted to maybe take a screenshot of that, but I think that's a
Oh,
very powerful slide.
yeah. No, actually, that's why I've been putting them in. Once I saw them, they really blew me away. I mean, you can use words. You have to be 6 feet apart, 4 feet, 2 feet, but a picture is worth 1,000 words.
Hmm.
And these are the kinds of things that just, I don't want to scare anybody in our practice, but these are the kinds of things that when I get somebody, kind of questioning and that. So I believe you're also going to have the recording, and you can send out the PowerPoint too. I don't have any problem with any of that.
Awesome.
Okay.
The next question also comes from Carolina, and I'm going to paraphrase. She wanted to know the statistic concerning, I'll just read it. What is the latest statistic available, or do you know of that motivational interview is a strong strategy to get smokers to move in, to basically change their habits? Um,
I can't tell you in any stronger words that it's probably one of the strongest ways to get somebody to consider changing. And notice I've said consider changing. We have these randomized clinical trials, and we're using motivational interviewing, whether it be with smokers, depression, or alcohol, or other risky behaviors,
mhm,
using correct kinds of protection devices from having a sexual relationship. MI in almost all instances, and this is now 30 years worth of work, will actually increase somebody's receptiveness to consider smoking, as well as the outcomes are much better. Now, the reason is because of the language. Just very quickly, motivational interviewing is non-judgmental, non-threatening, supportive. So just listen, do you mind if we talk about, that's the first thing that we do. We also talk about where somebody is on the scale from 1 to 10. There's some interesting things I can give you to whoever's out there. I can send you this information in a PDF so you can see what MI is about. But a few skills, including that decisional balance thing, way we talk to folks is really very different. And what it does is it not only validates, so what I hear you saying, so it validates, and that feels different. We're not condoning. You're validating, as well as getting to increase the thinking about it. Then you get into the decisional balance, and then you do one other thing more in depth is you say, wow, so what would be the best thing that would happen if you did quit smoking? And so we have a discussion about that. And then we also say, what would be the worst thing that would happen? And what one thing might it take to get you to quit? So you can have this conversation with somebody in a couple of minutes. We know the trials with physicians, and that's what I've been doing for about a decade at Nova. The trials with physicians do show that their patients, by and large, more of them will consider smoking, consider quitting smoking with that different kind of language. And what it is basically, and I'll stop, a set of communication skills with which to increase a person's motivation to consider changing or quitting. I'm a big fan of motivational interviewing. I should do a webinar on that.
Yes, you should. Veronique had a
Okay.
question concerning just wondering where kids get the money to buy vape supplies.
I don't know, but they were getting the money to buy cigarettes, and they would go to their older brothers and sisters. We know that data from how did you get it, and ask them to buy at the corner store. And that, I mean, they have money for for sweets and cokes and things like that. I don't know, but it's not that expensive to vape in one funny way.
Rachel has a question. It's more of a comment. Is the reason for smoking, said smoking may be relaxing because it's an acceptable escape from stressful situations. It's highly ritualized, encourage deep thinking and mindfulness. Maybe that's why individuals consider smoking.
I wouldn't disagree.
Okay. Um, Um, Cherie has a question. Is there any plan to make the Nicotrol inhaler available without prescription in the United States?
I don't have information. Probably just look online, but I can't answer that with any surety.
Okay. There was a question concerning the tobacco death statistics. Do you know the number of individuals who, this is from Scott, the most recent statistic I've seen for deaths per year in the United States from tobacco is approximately 480,000. Is that still correct?
I don't know that, but what I can tell you is it's probably not too far away, because what has happened in the last 5, 6, 7 years is we really were quite successful going from 60% in the early 60s of the adult population. Again, we're talking, these surveys include 12-year-olds all the way up. So it's not just adults, but that's what the language is. They were really quite successful. We started attacking smoking with secondhand smoke kinds of things, and it's very much like Mothers for Drunk Driving. So secondhand kinds of and grassroots up movements really were successful. We got it down to 30, we got it down to 20, and then I am answering your question. We got it down to around 16 to 17% before vaping started, and we were really pleased with that. But the last 5 years has seen it basically, kind of go that way, plateau, yeah, and flatlined, and we don't know why.
I apologize. It seems we have lost Dr. Sobel, so we will just wait for her to join us. So I apologize for that. These are great questions, by the way. Thank you so much for submitting them. Once she joins us, we'll make sure that she's able to actually answer those questions. Incidentally, I have also placed her information in the chat, and I'll go ahead and do that one more time. She is available to answer those questions, any other question that you may have concerning this process. So I'm actually, again, putting the link to her faculty profile in the chat, so you'll be able to actually send her information. Again, for some of you, if you would like to actually get this PowerPoint, please contact her directly. However, this recording will be on our website, and it should be available sometime next week. So again, I'm going to be putting this in the website. I'm sorry, in the chat. So you'll be able to go to that site, and this recording will be there. So we'll just wait for her. And again, please go ahead and submit any other questions you may have in the chat so we can have her answer those questions when she returns. Now, you saw us talking earlier today about the weather in Florida. This time of year will get lots of rain, and frequently that affects our internet connectivity. So I've actually been in a webinar where we've had really bad weather, and that had affected either my internet or the electricity. So again, and I believe Dr. Sobel is joining us.
I don't know what happened. I'm very sorry. So very quickly, what happens is, my guess is that the figures have not changed for the reason I just articulated. But in fact, what happens is we don't know why we aren't getting to these smokers. One suggestion has been that they're going after young women, and these younger people, it's going to take a number of years where they get serious about stopping, or that they have moved over to alternative methods of inhaling. But you can look it up, but I can't say that I can give you, yes, that number is correct, but my guess is it's probably hasn't changed.
Dr. Sobel, we're getting so many questions. I don't know. I know you have a meeting right after this.
Well, but I can stay on a little bit longer because it's going to take me 30 minutes to get to the university, if that
Sure.
would help folks. I don't mind.
Sure. So I'll be very quick in some of the questions. In terms of the motivational speaking, Veronique said on the onset of this session, we were given statistics on during this session, you were talking about giving the stats on the benefits of vaping. So what are the true stats for fatalities from COVID for smokers and vapors? Do we have the statistics on that?
Well, let's be careful. That's what I thought I was careful on at the beginning, but obviously not. So it's a two-edged sword. There's some funny things that you wouldn't expect is that smokers are less likely than non-smokers to contract it. They're also saying that there may be other things that look positive, but then when you actually get into the more rapidly expanding research, what you see is that COVID is 2 times more greater likely to be with smokers in an ICU, ventilated or dying. I don't know the statistics. The problem is these things change daily. I sound like one of the pundits on CNN. But the bottom line is, whether it's X million, 1 million, whatever it may be, there is nothing good about smoking and COVID or Delta now. It's a more severe progression because you've already got compromised lung functioning, and there is not a reason to tell anybody to continue smoking, because if you can stop for the cancers and the other kinds of things, you can stop now. We do know that you're less likely to end up, along with the boosters, to be in ICU, ventilator, or dying. Because when you're smoking, you're still every day ruining your lungs.
There's a compliment in the chat for you. Carolina says, I'm a psychotherapist and working with this kind of addiction, and it has been very challenging. I commend you for that because I couldn't specialize in it because it is so hard. So So Kelly would like you to do a webinar on motivational interviewing. It would be helpful to see how it's used in different areas, including drug abuse, weight loss, mental health, etc. So stay tuned to this channel for that. I have placed just to remind everyone, I have placed Dr. Sobel's faculty profile in the chat, so please visit that site. And
Let me, can I say one more thing? For those of you, I didn't put it on there, but for those of you that are interested, if you will go to our website, you can download all of the smoking cessation interventions, all of the other pamphlets and so forth. And it's www.nova.edu, then it's /GSC, and the GSC is for Guided Self-Change. If you go there, not only will you see all the interventions, but all the motivational interviewing material too.
And I'm going to put that in the chat for everyone.
Thank you. Yeah, I'll commit to an MI workshop, but in, let's say, early December.
Okay. Kelly also had a question. If you had one thing to say to someone to stop vaping after asking permission to comment, what would you say would be the most important?
If you continue to vape, where do you see yourself in 5 years? Oh, you're asking somebody to forward think. So that was one question. If I had 2 or 3, I would say something more.
Laura has another question. How do we know why smokers are less likely to get COVID? And again, that's what you said at the beginning. So we will move on.
Okay.
Christina says, what are your thoughts concerning about those individuals who use vaping to help with smoking cessation?
Well, initially, the studies coming out of the UK, United Kingdom, were saying that they were helping smokers quit. And it alarmed a lot of us in the field, really alarmed us.
What it may be, okay, my ear pods are not working here. It seems to be working today. Can you hear me now without the
Yes, yes, we can.
I can't hear you, so something's away. I've watched the once, by the way.
So we are not able to hear you now.
So there we go. Now we can hear. So the initial studies coming out when vaping first started indicated that it was helpful. Now we were scared about listening to that, and what we started thinking is, why would that be? And we think that some folks actually switched over to vaping thinking they could taper off from smoking, and that has been reported, but it isn't something that's recommended at this point in time for those of us that are in the field.
So, Dr. Sobel, we are at 1:02, and I believe this would be a lovely time to end our presentation. And so I am actually adding, again, your information to the chat. So thank you so much. Any final thoughts before we end our session?
If you need any help from us, contact the website, contact my email, and we will respond to you. Everything is free, but we're out there to help you, help your patients. So have a good weekend and stay safe. Okay?
Thank you. Thank you. Wonderful. And thank you everyone for joining us. We do appreciate you spending some time with us. Again, this session was recorded and will be available next week on our website. So please have a good weekend.